Good afternoon, everyone. I'm Pauline Grace Abellaneda, together with Samantha Nicole Sereno.
In the year 2019, the coronavirus diseases are also known as COVID-19 pandemic. The social distancing measures implemented by many countries have caused disruption in daily activities. As of April 8, 2020, schools have been suspended nationwide in 188 countries according to UNESCO. More than 90% enrolled students, 1.5 billion young people worldwide are out of education. UNESCO Director General Audrey Azoulay warned that the global scale disruption in education is apparent for children to youth with mental health needs. This closure means a lack of access to resources they would normally have to schools. In a survey by mental health charity Young Minds, which included 2,111 participants up to age of 25 with a history of mental illness in the UK, 83% said the pandemic had worsened their conditions. 26% said they could not access mental health supports or support groups, and face-to-face services have been cancelled, and support by phone or online can be challenging for some young people.
School routines are important coping mechanism for young people with mental health issues. When schools are closed, they lose an anchor in life, and their symptoms could relapse. Going to school had been a struggle for some children with depression prior to the pandemic, but at least they had school routine to stick with, said Zanonia Chu, a registered clinical psychologist working with children and adolescents in Hong Kong, where schools have been closed since Feb. Now that schools are closed, some lock themselves up inside their rooms for weeks, refusing to take shower, eat, or leave their beds. For some children with depression, there will be considerable difficulties adjusting back to normal life when school resumes. Children with special education needs, such as those with autism spectrum disorder, are also at risk. They can become frustrated and short-tempered when their daily routines are disrupted, and said by psychiatrist Chi-Hung Ui, University of Hong Kong, China. He advised parents to create a schedule for their children to reduce anxiety, reduce uncertainty with speech therapy sessions and social skills groups suspended. He cautioned that stopping therapy can stall progress, and children with special needs might miss their chance to develop essential skills. He points out that creative ways such as online speech and social skills training are needed to make up for the loss. Many countries are postponing or canceling university entrance exams. In Hong Kong, the authorities made a last-minute decision on March 21 to push back the Diploma of Secondary Education (DSE) exam, which were scheduled to start on March 27 by month of April 24. According to a poll by the student counseling group Hock Hue Club in March 2020, over 20% of the 757 candidates surveyed said their stress level were at maximum 10 out of 10. Even before the postponement was announced, 70 years old DSE candidate Yo-Yo Fong has been experiencing loss of appetite and sleep problems and said she found the uncertainty of whether the exam could be delayed further stressful. I have a hug wave of fear that I might contract the virus and thus cannot make it to the exam. Staying healthy has become another stressor, she said.
Meanwhile, college and university students are stressed about their mandatory evacuation and cancellation of anticipated events such as exchange studies and graduation ceremonies. Some lose their part-time job as local businesses close. Students in their final years are anxious about the job market they are going to enter. College students are more vulnerable than we think, especially with the current academic and financial burden, said Chui. Social distancing measures can result in social isolation in an abusive home, with abuse likely exacerbated during this time of economic uncertainty and stress. Jinli County in Hubei Province, China has seen reports of domestic violence to the police more than tripled during the lockdown in February, from 47 last year to 162 this year. Increased rates of child abuse, neglect, and exploitation have also been reported during previous public health emergencies, such as the Ebola outbreak in West Africa from 2014 to 2006. However, not much is known about the long-term mental health effects of large-scale disease outbreaks on children and adolescents. While there is some research on the physiological impact observed acute respiratory syndrome on patients and healthcare workers, not much is known about the effect of ordinary citizens. Evidence is especially scarce in children and adolescents. This is an important gap for research, EU said. COVID-19 is much more widespread than SARS and other epidemics on a global scale. As the pandemic continues, it is important to support children and adolescents facing environment and issues related to parental and employees or loss of household income. There is also a need to monitor young people's mental health status over the long term and to study how prolonged school closures, strict social distancing measures, and the pandemic itself affect the well-being of children and adolescents.
That's all. Thank you for listening. Again, I'm Pauli Grace Abelladina, together with Sabato Nicole Serino, and thank you for watching.